I'm just going to read this, Nadine, hopefully. But I think that we need to add some nuance about gender, race, disability, class, et cetera, in terms of mental health support. Okay, there's something for you, Michael. And that was actually going to be the next thing I was going to go to, is what kind of things can we go to? I'm going to keep reading that. So we know, for example, that women of color have their concerns more often dismissed by medical professionals. I'd love to hear Michael comment on some cultural aspects of mental health. Thank you, Nadine. What an excellent contribution. Now, go ahead, Michael. I'm going to go back to speaker view to give you some
Sure. So Nadine, yeah, you've definitely identified that correctly, and it's I don't think it's acceptable. We've been doing a lot of work in our organization to try and make sure that we understand how different people talk about mental health, and different people from different backgrounds talk about mental health, because it's not universal, right? How the culture we're raised in will change how we view mental health. And it also changes the resources we have available to us. So it's like, I do agree in our Western medical system, people from diverse backgrounds, people of color, racialized people are often not taken as seriously, or sometimes not taken as seriously in terms of mental health concerns. But another way of looking at that is there's also sometimes different resources in different cultures. So, in cultures that have more of an extended family, there's often more of a support network that people have access to. Again, that doesn't mean there's no mental health concerns or no mental illness. It means that it's dealt with differently. I also would want to acknowledge that many First Nations view mental health in a very different way than settlers do in North America. There's both a respect and an honor for the different gifts that people bring to it, and that difference is often seen as a gift instead of as a problem. But also that wellness is seen much more broadly, and understood to be much more broad. And I wouldn't want to talk about it in too much depth because it's not the tradition that I come from. But just when I've had the privilege of sitting with elders, when they talk about mental wellness, it's in a very different way than I would have talked about it. And so I think it's really important to acknowledge that, and to acknowledge that there are also traditional ceremonies and cultural practices that can help in ways that those of us not from those cultures may have some trouble understanding and may not think of right away. But helping someone to connect or reconnect with their identity and with their culture and cultural practices can be helpful if that's something they're seeking.